Good afternoon, everyone. Good afternoon, everyone. I'm Steve Klotz, and welcome to this webinar, which we are devoting to the topic of scorpion stings in Arizona and what healthcare workers need to know about taking care of individuals victims of scorpion stings. And this is part of a series I've designated as Desert Expertise, where this is not a formal presentation like medical grand rounds. It's something a little more informal. I gather a couple of experts and sort of focus our attention on a very narrow field so that you can go away with some sound advice and facts. And so today's speakers will be myself, followed by Dr. Justin Schmidt on the biology of these scorpions. And then we'll end with Dr. Shirazi speaking about the treatment of scorpion stings. So this is all part of Improving Access to Quality Medical Care webinar series provided by the Southwest Telehealth Resource Center and the Arizona Telemedicine Program. When you joined this webinar, your phone or computer microphone was muted. Time is reserved at the end for questions. Use the chat function, if you will, please. We should be finished in about 45 minutes, so it should leave plenty of time for questions. And if you'd be so kind, fill out the post-webinar survey. This is all being recorded, and you can find it at the site that you see underlined in blue below. So the objectives of this presentation will be to inform healthcare workers on the epidemiology of scorpion stings in Arizona, which I will provide. And then Justin Schmidt will talk to you about biology of Centruroides sculpturatus, one scorpion that is most dangerous. And then we'll end with, as I mentioned, Dr. Shirazi talking about the treatment of C. sculpturatus envenomation. So, as all of you are well aware that are here in Arizona, we have a pretty rugged landscape, and it harbors a number of venomous animals and toxic plants. And it's one of these animals is Centruroides sculpturatus, whose venom can cause severe neuromotor disturbance. So I'll tell you a little bit about a study that we performed, and then the other two speakers will follow. So the reference at the top of this slide is to a paper a group of us published on scorpion stings in Arizona. It came out in February of 2021 in the American Journal of Medicine. And here we analyzed 4,398 calls regarding scorpion stings that came to the Arizona Poison and Drug Information Center in Tucson. This is not including data from Phoenix. Over a period of 3 years, from January 2017 through December 2019, or to January 2020. The most common complaints among all these calls were the fact that they had pain at the site of the sting, and there was often local numbness, as you can see, in 62%. And we do have very detailed clinical information, including lab values, et cetera, from 593 calls, which originated from a healthcare facility within Arizona. So these were the individuals who were most ill and were seeking treatment. Before I get to that group, let's just look at this over 4,000 stings and their calls. And as you can see, I have split this out into different decades of life. And there may be a little overrepresentation of calls for the age group 0 to 10 years, but you'll find out why here in a moment. Otherwise, it's pretty well evenly distributed. But what you see in the right-hand column is those who received antivenom, which is a very effective product that Dr. Shirazi will talk about later. It's virtually confined to the under 10 age group. There are a few others scattered in each decade of life, but these are probably related to the muscle mass of the victim, because that will reflect to some extent the concentration of the venom. And here are symptoms and signs of the ones who needed therapy. In other words, the other virtually almost 4,000 calls, they were told to put ice on the sting site and take just common sense measures. And as you can see, I've listed the most severe signs and symptoms, or signs actually, and they include nystagmus, and it's often rotary in children. And if you haven't seen what rotary nystagmus looks like, you might want to look on YouTube and put in Arizona scorpion sting rotary nystagmus. And there's a very nice YouTube provided by Dr. Leslie Boyer that shows this in a child. Agitation is a common sign. Excess secretions, hypersalivation, is one of the most important signs. And as you can see in the very far right-hand corner, individuals who had this presentation, 80% of them received antivenom. So it's a grave premonitory sign. And fasciculations can be common as well. The only other group that, or symptom or sign group that acquired such a rate of administration of antivenom was having a sustained tachycardia. As you can see, there were cases of acidosis and rhabdomyolysis as well. And here are the related, these symptoms and signs broken out here by the age groups. And as you can see, a point we will continue to make is this is a really concerning problem in young children. And the smaller they are, the more severe the presentation can be. So you can see that all these excess secretions, they're all sort of concentrated in this age group: nystagmus, agitation, fasciculations, etc. And as a list that exceeds all of the other, or kind of fills out this list, if you will, here are some others that included acidosis and hyperventilation, rhabdomyolysis, bronchospasm, etc. So these individuals were given an antivenom, which Dr. Shirazi will talk more about in a moment. And it was administered to 145 patients. Half the patients were less than 10 years of age, or actually were less than 5 years of age. Another quarter, I think, were less than 10 years of age. So it left about 25% of the patients who received the antivenom, and they were more in the adult phases of life, and likely were ones who had a small muscle mass. So I'm going to turn this over to Dr. Schmidt, who will talk to you about these scorpions, and I'll switch over now. See if I can share here. Excuse me a moment.
Hello there. Scorpions are fascinating creatures. Their biology is something that's kind of a sense of beauty. And what I want to do is present how we in this beautiful desert landscape can enjoy the landscape and not particularly worry much about the scorpion problem. So let's see. I'm gonna try to load up my slides. Oops. There we go. That's a beautiful creature. This is our star performer. And we'll,
We're not seeing your screen.
oh, can you put it on?
What you want to put on?
So press the share
Yeah.
screen button.
Well, we should have done that already. Let me see.
Yeah, you have to restart it after someone shares.
Okay, just one sec. Sorry, I'm
So do you see the share screen button? It's at the bottom of your Zoom
Yeah,
window.
yeah.
There you go.
See it now.
We see your screen now. Bring up your PowerPoint.
But he cannot see his own screen. Where's the PowerPoint? Where's your thing? This one?
Yeah. Oh, no, I think that's when we just had.
Where is your PowerPoint? Is this one? Is this the
Yeah,
PowerPoint?
that's it. There, I think we're back in business. I'm sort of techno compromised, so you have to put up with this.
Okay,
And put that in full screen.
it's a space, right? How you advance it? No, no, advance it.
There,
Looks great.
good, okay, now we're up and going. There's a lot of different scorpions. They're quite beautiful and quite unique. Some of them are fat, some of them are skinny, some of them are delicate. The fascinating thing is there's lots of species. There's over 100 in the US. And guess what? We have as many as anybody does. We have 57. So that said, there's only one dangerous one, the bark scorpion, the Centroides exalcauda. So 56 of our scorpions are completely harmless, make wonderful pets, and so you don't need to worry about those. Basically, the biology of scorpions is they are all predators. So in many respects, they're quite beneficial. They eat the cockroaches and caterpillars and flies and things that we sometimes don't like in our houses and such. They're all nocturnal. They don't come out during the day, so they're only during the night. They're long-lived. That is, some insects will live only a couple of weeks. Scorpions will live 2 or 3 years. And the largest one, the desert hairy, will actually live up to about 20 years. So they're long-lived. And in concert with that, they have a very low reproductive potential. You can see on the second picture down, there's a mama scorpion. She's got 3 babies riding on her. They usually have just a dozen or so babies at a time. So pretty low reproductive potential. They all can sting. This is something people often don't think about. They're actually very clean and they do not carry any disease. So they're not like flies or something of this sort. They're actually, other than being a little bit scary, they're completely beneficial. So a unique feature about scorpions is, and there's no other animals that do this, is that you can see on the left picture up there, it's a nice well-fed scorpion. In the light, if you turn off the light and go here to the right one, you'll see how they fluoresce under ultraviolet light. And this is caused by beta carbolines, which are highly aromatic compounds that are in the integument of the scorpion. Now, I always get asked, and everybody asks, why do they have these? That's been one of the biggest debates going on for the last 100 or 200 years in the scorpion research arena. We have no idea why they do that. But anyway, it's very handy for us that we can use them to search around and find them. So now, specifically on Centroides, the bark scorpion, their biology is strictly nocturnal, like other scorpions. They live in or near rocky areas. This might surprise some people because the name is bark scorpion, and rocky areas usually don't have a whole lot of rocky areas don't have a whole lot of big trees with bark on them. Or they can live in riparian areas, often under the bark of dead trees. And that's where they got the name bark scorpion. A little history there. Original settlers settled along the waterways, and the waterways where you could do agriculture. So they never got into the rocky areas. I mean, what are you doing in rocky areas? Nothing you can do there. You can't grow anything. You know, it's just ugly landscape. A cow even has trouble with it. We call that area now the foothills. Anyway, so they got the name bark scorpion historically, but in actual practice, they're more common in the rocky areas of the foothills and areas like that. It's the only species that's gregarious in retreats. In the upper slide, you can see kind of vaguely, there's a whole heap of them all piled together. No other scorpions will do that. The other ones, if you put two together, you end up with one fat scorpion. You put a bunch of bark scorpions together and they get along just fine. That's useful for and helping to identify. In other words, if you see two scorpions or more together, the chances are they've got to be bark scorpions. Another interesting factor is they're excellent climbers. Back to rock scorpion. They can climb rocks, they can climb trees, and they can actually climb the walls of your house. And you see in the bottom picture, there's a scorpion in a skylight. So how did it get there? Well, it climbed up the wall and found a little crack and scooted in. So if you see a scorpion on the wall or in a skylight, then you know that that's a bark scorpion, so don't grab it. They're present in desert areas of Arizona, California, New Mexico, Nevada, Utah, and adjoining Mexico. Distinguishing features, how you can tell for sure if you have a bark scorpion, they're light yellow colored, picture on the left. They're very light, they're thin and delicate. On the right, you can see their pinch or their claw. You notice how it's long and thin and good for manipulating, not too much meat or muscle on it. And back to the left one, you can see the tail is very, very long compared to the body. It's about twice as long. And the arms, although they're folded back, are also quite long. And this is unique to them. Features that are not of bark scorpions are dark brown, such as the larger one in the left. And you can see the bark scorpion on the right. They're sturdy looking. You notice the bark scorpion is kind of anemic looking, very delicate scorpion. Other features are just repeating. You can see the big, strong pinchers on the left or in the center. And then again, showing the centroides is a very delicate pincher there. One thing that used to be commonly said was, oh, you can tell the difference by seeing this little tubercle. You can see it on the left picture there, just by the pointy sting. Well, it turns out that's not a very good diagnostic feature because some bark scorpions don't have them particularly visible, and some other scorpions do have them. So disregard paying any attention to that. The ace in the hole for us as biologists or for homeowners is you can detect them with black lights. And you can see you can buy these at the hardware store. They're fairly cheap, about $10. And when you turn off all the lights in your house and shine them around, especially around beds or any place where you think you might inadvertently step on a bark scorpion, something you don't want to do. I'm not going to go over this much detail. This just stings of them. And Steve pretty much covered that, so we'll skip this one. I guess the important point is they're life-threatening only to very small children and to frail elderly people. But the good news is, of course, we now have antivenom, which is exceptionally effective. It really does the job. It's just beautiful stuff. So just as an aside, a lot of people want to spray their house with insecticides and these sorts of things to control bark scorpions. They don't really work very well. You're often risking, contaminating your environment more than you're doing anything useful. And the reason they don't work is they're very smooth cuticles. So if you use a powder, they don't stick to them. If they don't stick to the scorpion, it's not going to hurt it. And they don't breathe like insects who have trachea, kind of a breathing system. They don't have that, so they can't inhale it into the system that way either. And they do not move around much. So if you have something that's sitting in a corner maybe for days on a time, and you sprayed not in that corner, you're not going to get them, of course. And the other thing is they're incredibly low metabolism. So if you have a high metabolism, which is why fly sprays work, flies just metabolizing like mad, and they suck in the insecticide and crash to the floor. But scorpion has a trivial amount of metabolism, so they don't metabolize much, and therefore they don't have to deal with the insecticide. It takes several days to kill them. So it almost requires spraying directly on the scorpion. So my response is, why bother? Try a boot. I hope you enjoy this. We'll turn this back to Steve for Mazda to carry on.
I guess I'm gonna be taking over. I'm gonna see if I can get my PowerPoint presentation up. Can you see my PowerPoint presentation?
Not yet.
Not yet. So let's see. Why isn't it getting it? It's interesting. Share. Okay, I don't know why it's not. Here I go again. It's actually not allowing to share my PowerPoint. Do you see it?
No, not yet. So when you hit share screen and you select the PowerPoint, it won't let you share it?
Yeah, it does. It gives me sort of a colorless background with almost like a danger. Doesn't allow to share.
Do you want me to bring up?
Yeah, could you just bring it up on yours and we'll just go through it? It's easier to do it that way.
Okay, it'll take me. a
I'm
moment.
glad we did it. There's always something with technology. Now, I couldn't see yours before. I don't know if I can see it this time.
Okay.
Are you sure?
No, I'm not there yet. I've got to bring it up. It'll take a moment. Okay. Now,
Are you sharing, Steve? I can't see yours.
I will, just a moment.
Oh, okay. Okay. Yeah. Okay. So I'm Mazda Shirazi. I'm the medical director of Arizona Poison and Drug Information Center. Can we go to the next slide, please? So scorpions, as Dr. Schmidt mentioned, they are animals that are all over, and you can see here by a map that sort of drawn, you can see them everywhere except in Antarctica. Next slide, please. So there are many species, about 16 families, but there's about 2 of these families, the Buthidae, which has the largest number of medically important scorpion, and then there is the Hemiscorpionidae, scorpion that one species specifically in Middle East that causes what we call a snake-like tissue toxicity. And there is some disagreement about whether there is a couple of the species in Scorpionidae that also are medically important. Next, please. So here again, you can see the species and the families that are of medical importance or clinical importance. And of course, our sort of focus here is on North America and the Centroides. And the Centroides vittata is the most common scorpion, at least based on medical entomologists. But we are focusing here on the Centroides sculpturitis, which is the most important one that causes neurotoxicity. And here again, it shows sort of a density of envenomations, or as the Brits call it, envenoming. And I draw a circle around it. So we get in the area that's purple, we get about 1 to 100 per 100,000 population envenomation. Next slide, please. In Arizona, of course, Justin and Dr. Schmidt spoke about the number of species that are present, but the most important one medically, of course, is the Centroides sculpturitis. This is a disease that we get lots of calls about. Most of the calls, of course, are people who are afraid. Nationally in 2019 was about 10,000, 9,700 calls, but most of these were not actually of medical important calls. These were people who have moved into the state, they have heard about our scorpions, and they are worried. And most of those calls, of course, comes from the center of population and in Arizona, which is Maricopa County. The percentage of calls that we get is about 2,000 of those calls, and most of them are actually envenomations, although again, not medically important, meaning these are scorpions that are not Centroides sculpturitis. This is a disease that occurs at home, so you don't have to be outside digging in your, in the desert. Usually, there was a study that was published by our colleagues, Dr. Erin O'Connor and Michelle Ruha in Phoenix, and they showed that most of the ones that were medically important in children, they occurred in the bedroom, living room, or the bathroom. And if you take those out, then the rest of them will occur also in the yard, whether the adult or the child is digging or playing. Now, out of those 10,000 calls that are received, only about 276 required any antivenom therapy, and most of those were children under age 6. Next one. So they are the alpha type toxin. This neurotoxin is what causes most of the problem. This is for those of you who are physiologists and biologists, this is the one that interferes or opens the sodium channels and prolongs the activity of the sodium channels. And that's the main toxic fracture or fraction of the venom. The rest of the venom has lots of enzymes, lots of biogenic amines, and other compounds that allows for the venom to spread. Venom of almost all scorpions causes pain. However, in a child, you will find out that the pain is not the most important symptom because they can't communicate that. Next slide, please. So how can we determine what's the severity? Is there a way to determine severity? Well, we know that stings, and by the way, they sting, they don't bite. We always get calls about scorpion bites, and you want to drive one of our specialists on the phone nutty, just call it a bite. So anything on upper thorax and the neck, we can see more severe outcomes in terms of neurotoxicity. And that's also true about cardiac toxicity with scorpions, especially the Buthidae family, that are from other areas of the of our area, meaning the old continents and such. The age of the victim and the weight of the victim matters. And the smaller the victim is, the more we see symptoms. In children, because of the narrow airway, we do see lots of respiratory involvement and respiratory derangements, which scares the heck of almost all providers. And if you want to see physicians, nurses, technicians in the ER that deal with death and life and death every day, be sweating and running around and finding him in distress, send in a child who's been envenomated with a neurotoxic scorpion, and it causes severe distress for everybody, for mother, for child, and for everybody involved. Weight matters, and we, as Dr. Clark mentioned, elderly also whose weight is we usually consider lower than 50 kilograms tend to show much more severe response to this. Number of stings matter. Some of the worst stings that I've seen, especially in adults, was a lady in a nursing home who had a scorpion in her bed, and she got envenomated multiple times. Except for the airway compromise, she had some of the most severe envenomations that you could see. And of course, the health of the victim. If they have other morbidities, there's problem. Is this the next one? So symptomology matters. We said almost everybody has pain, but you can't assess pain because children are not going to communicate that. Restlessness or hyperactivity, hypermovement is the main important one. Vomiting, nausea, and secretion, increased secretions, and inflammation. Now, adults will tell you, I have a pain similar to when I hit my funny bone, that radiating electric pain. Children cannot communicate that, and that causes a lots of confusion. Next one, please. So if you look at what the scorpion venom does, it causes neurotoxicity through those sodium channels we mentioned. It also causes a release of our own catecholamines or adrenaline, noradrenaline, and other biogenic amines. So there is a hyperactivity, there's that tachycardia or increased heart rate, there's that high blood pressure, there's that movement, sweating, foaming at the mouth, secretions coming from the nose and through the airway. And all of these will come together to cause what we call, especially in a child, a syndrome of a pulmonary edema and respiratory distress that could require them to be intubated. Next. So again, here showing that sort of a cartoon that I put together, showing that the sodium channel activation, both at the presynaptic axon and postsynaptic activation, is the major cause. So you get lots of biogenic amines, acetylcholine, which is the main neurotransmitter released, and there's lots of muscle activity. Next. So there is a gradation of scorpion envenomation or sting, and then there's a syndrome. In the gradation, which works in adults really well, and sort of cognitively, if you want to be talking about it, makes sense, is something that internationally was adopted. And then Dr. Carey, Steve Carey, one of our colleagues in Phoenix, he came up with this gradated sort of measurements of the symptoms. However, in a child, you're not going to see this. You're going to see pretty much a child that's in distress. You're going to see cranial nerve involvement. You're going to see foaming at the mouth. You're going to see movement disorders, eye movement, and that is going to cause lots of confusion. What is this? Is this seizure? Is this exposure to pesticides and such? So I usually, for myself, I categorize these with vital signs abnormalities. So the ones that you see in yellow. Can we go back?
Yeah, I'm trying to,
Okay. Then I look at the cranial nerve and what I would call neurotoxicity of neuromuscular toxicity, which those involuntary movement, nystagmus and rotary nystagmus or opsoclonus is seen. Unfortunately, what happens with that when that's occurring, a child or even an adult, they find out that that causes lots of nausea and vomiting. They close their eyes. So most providers, they do not open the eyes or pull the eyelids up to see that the eyes are going in that circular motion up and down and round and round. Sweating is something that you can see, especially with lots of activity, but you're not going to see any paralysis. This is not a toxicity, neurotoxicity that causes paralysis. And then you're going to see lots of hypersalivation, lots of mucus production, lots of respiratory difficulty because of all these secretions and hyperactivity. So I would suggest if you see increased heart rate, you see increased movement and activity that looks like almost like seizure, except they're going eye movement going on and hypersecretion, you got to be thinking about scorpion toxicity. Children are not going to tell you about pain. And I remember working with Dr. Boyer that we had a child that came in. We asked him, it was an older child. We asked him, why do you close your eyes? And he says, because my world is jumping up and down. So next, please. So again, here, before I get into the antivenom, I just want to show you that if you look at the third column where it says placebo on it, this is from the paper that Dr. Boyer wrote in New England Journal. This was based on a study of about 2,000 individuals. However, they only chose about 17, so 6 of them envenomated and another 7 envenomated but did not get treated to show the differences. So you can see that neurotoxic signs and symptoms can go on for 4 hours. They peak at 4 hours and then they start going down. You can see that also in terms of abnormal eye movement, they go on about 4 hours and then they start turning around, and it doesn't turn around immediately. It doesn't turn off immediately. Respiratory issues, we see it up to 2 hours after. And the story is usually this: a child was sleeping or playing. All of a sudden they start crying. They run to the caregiver. The caregiver sort of consoles them. They become calmer. And then within minutes, they start getting out of hand, crying, moving, vomiting, snot coming out of their nose, foaming at the mouth. And the caregiver goes nuts. It's like, what happened to this child? So again, that story, whether they were playing, pain, consolability, and then having the movement disorder, or sleeping, waking up, then becoming consolable for a few minutes, and then going fulminant movement disorder, that is one of the main criteria for diagnosing this. This is not a common enough disease that even our pediatric ER doctors who are well trained would see all the time. They don't see enough of it, so it can easily look like other diseases. Next one, please. So internationally, they do not recommend ice, but we know locally, if you don't put pack of ice on there and leave it on the child's extremity to cause frostbite, but if you apply ice to the area, if you can know what area it is, which usually adults will tell you, children can't. And with centroides, there is no marking, there is no edema, there is no redness that you could sort of figure out easily on a child, especially one that's unconsolable, moving around. So, but putting ice on it, it actually decreases the spread. But putting a warm pad on it, for example, it will make it a fulminant disease immediately. So do not at least use heat. Analgesics tend to work. Now, if it's not neurotoxic scorpion, local and topical stuff will work. Topical anesthetics will work. Otherwise, in a healthcare facility, supportive care. Lots of it is suction. Lots of it is giving oxygen. Lots of it is giving some benzodiazepines and figuring out what this is that you're dealing with. And airway management, we have had airway deaths in children who've been envenomated, and that's very important in these kids. Next one. You can't talk about the antivenom and this disease without talking about people on this slide and lots of other physicians, nurses, scientists, and staff personnel. From Dr. Al Piccioni, that about the same time as Herbert Stanke moved to ASU, then the Teachers College, and Dr. Piccioni established the Poison Center and started dealing with these, to Dr. Stanke that came up with the first antivenom, which was a goat-derived full IgG antivenom, to Dr. Sullivan and Dr. Findlay Russell, who actually generated the first snake antivenom at the University of Arizona and showed that it can be done. And then to Dr. Boyer and Dr. McNally. Dr. Boyer, of course, went to scientifically work to do the clinical trials, which myself, Dr. Chase were involved with, and brought the knowledge from and the clinical trials to the US to Dr. McNally, who went to become the CEO of Rare Disease Therapeutics, which now imports and distributes the antivenom. They've worked together at Arizona Poison Center for over 20 years, and they went different directions, but both worked in a way to bring this antivenom to Arizona and to United States so that we can treat children especially when Dr. Stanke's lab stopped producing the antivenom at ASU. And that was the only drug that was only allowed to be used in Arizona. And by the way, because it was a full IgG, had lots of side effects. To our specialists, the 2,000 plus clinical trial subjects, they were all recruited through the Poison Center by our specialists who answer these phone calls. They are pharmacists, they are specialists in poisoning. And without them, this antivenom and this therapy, which is curative, would not be here in Arizona. Next slide, please. So the antivenom is called the Anascorp. It's a Centroides Fab2, so it has the FC portion clipped. For those of you who liked immunology, it's produced in horses. The initial dose to give is actually 3 vials. What we see is the mistake of trying to give it one at a time, which makes that syndrome, especially in a child, become unmanageable. The study that both Dr. Boyer was involved and Dr. McNally were involved, the average number of vials that it took to control the disease fully within an hour was 4.2 vials. Next one. So this is actually produced in Mexico under FDA guidance and inspection. This is antivenom again in horses. It was produced against 4 species of Centroides in Mexico, and it tends to work against Centroides scops also here. It's again Fab2. The way it's given, 3 vials in 5 mils of or 50 mils of normal saline, and we give it over 10 minutes. We wait half an hour. If the signs and symptoms have not subsided totally, then you have to give 1 or 2 more vials. And again, the disease could be fulminant, and it takes time. Most people at this point, instead of doing some airway support, suction, giving some atropine to dry out or Atrovent to dry out locally the secretions, they become exacerbated and they intubate the child. But really, they are within minutes away of the child turning around. And we have looked at many of these when they get intubated, and all of them within hours, they turn around. The ones that don't are the ones that receive high doses of benzodiazepine. And again, in order to control a child with this toxidrome, you need 10 to 20 times the normal dosing per kilogram of any of the benzodiazepines. So what happened, the scorpion toxidrome goes away, and then you have the benzodiazepine toxicity taking over, and the child then is intubated or needs airway support for a prolonged period of time, not because of the scorpion, but because of the therapies that were given. So lots of times the prolongation of child's hospitalization, it's an iatrogenic or physician-caused disease. Next, please. Again, here, what we're trying to show is tachycardia occurs, so heart rate goes up, but in majority of children, and even when we looked at them at the pediatric ER, only 50% of them get a blood pressure check. And again, it's because the child is moving all over the place. And Dr. Klotz has a really good suggestion to go into that New England Journal, that video that Dr. Boyer loaded of a child that we helped here at the university, to see how horrendous it is and how chaotic it is. So not having a blood pressure is common. And what will happen is early on you have hypertension, and then when things become exacerbated, a child or adult can develop hypotension. And usually, again, because of the airway compromise, children are the ones that we worry about, and they are at the risk of death because of the airway compromise. Next. So there's lots of laboratory derangements, but acutely, none of these are useful. And nobody tells you to go get a CK or check a cortisol level or get a liver function test. These are not useful. That toxidrome, recognition of the toxidrome based on the story and based on those three criteria in the vital signs, neurotoxicity, and secretions is what will direct giving the antivenom. These are all come later, and unfortunately, although they are academically sort of curiosity value, they do not help you to take care of the child. Next. And again, here, this is the international grading of scorpion envenomation that one of our colleagues, Jeff Isbester in Australia actually put down, which is similar to what Dr. Curry in Phoenix had put together. Next, please. Here again, this is for those of you who are physiologists or neurologists, showing that the scorpion venom, where it actually interferes is the opening and maintaining those sodium channels open so that that nerve ending continuously releases neurotransmitters, and that's where the problem comes. And for your satisfaction, we put also some other, the snakes and black widow venom there also. Next, please. So here again, it's comparing scorpion, spider, and snakes, and this is important for us because we see lots of these, and we wonder which one is it that's causing this. And again, scorpion, all of them cause pain. I would tell you that with snake, it's not common. Pain is not common except later on. Involuntary movements in Arizona, we do not see it. Even with our neurotoxic snakes, we do not see it. With scorpion, we see it. Dysphagia and dysarthria, it's the child is in such extremis that they're not going to be able to talk to you or swallow so that you can assess it. In adults who have secretions, but their airway is larger, we've actually have shown that these are significant problems, and they are present. Hyperesthesias, paresthesias, child is not going to give you that, and we don't see much of it in the scorpion. And usually it's later on with the neurotoxic in adults, they complain of hyperesthesias, paresthesias going on for weeks sometimes. Fasciculations can be seen, especially if adult is thin, because they have muscle mass. In most children who get, these are children that they're a little bit chubby, they're round there, that children under age 5 are, and it's really much harder except around the eyelids to be able to detect fasciculations. Hyperactivity is most important. Sweating you can see because of the hyperactivity. And again, there is no ptosis, meaning there's no paralysis of the eyelids here, but the child or adult will close voluntarily their eyes because of the stimuli that they're getting. Next, please. So one of the things that you can be assured of is if you give antivenom early on and you give enough antivenom, this is a disease that turns around. We have shown it now in the study that was done with 2,000 patients that the state of Arizona and Arizona Disease Control Commission, ABRC, funded, then Arizona Department of Health funded it, and now with our clinical experience, that this is a disease that you treat the child, you treat the adult, and in 4 hours, they go home. In a child or in a elderly whose weight is really low and they had multiple envenomation, this can be of saving them from significant morbidity and mortality. Antivenoms, unfortunately, because of the structure of licensing and pharmas seeking profit, they are not cheap, but they are, compared to many of our drugs that we use, they are cheap enough that they're curative. We spent hundreds of millions of dollars, billions of dollars on some of the chemotherapeutic and now antibodies that are produced for various diseases that are much more expensive, and they're not curative. This antivenom is curative. You get a child that can die from airway compromise, and in 4 hours, they go home with their parents. Thank you.
All right. Thank you very much, Justin and Mazda. Excellent discussion. And if anyone has any questions, you can put them up on the chat box there. And as I mentioned before, this whole presentation will be available archived on the Arizona Telemedicine Programs website. So I don't see, well, let's see here. Do we have some questions?
I can't tell.
Well, I don't see any at this moment. So I guess what we'll do is let everyone finish their lunch or whatever they're doing and probably get back to work. And we thank you very much for attending this webinar, and we enjoyed giving it, and I hope you gained some knowledge while listening to it. So we'll sign off from here.
Thank you.